Hello everybody, my name is Kevin Kramer. I am the CEO at Modoc Medical Center and just wanted to provide an update on what Modoc Medical Center is doing related to COVID-19, just so the community is aware of what we have going on. First of all, there's a lot of operations that are in place to protect patients and our staff at this time, and I'm sure those of you that have needed services lately are aware of these things. But I'll go over them again here just so that everybody's aware. Right now we do have screenings that are occurring outside of most of our facilities, or pre-screenings that are occurring for services that are outpatient services and scheduled. So you'll notice that we have a tent outside of the hospital. We're getting everybody's temperature there, also asking questions about travel, asking questions about symptoms that are COVID-19 symptoms as well. Those same questionnaires are being asked over the phone for anybody that has clinic visits, physical therapy visits, dental visits out at Canby as well. And those tools are really in place just so that we are limiting the exposure or potential exposure to our facilities at this time. We are just trying to protect our staff and other patients the best way possible. You'll notice that a lot of our staff members are wearing masks when you come to our facility. Right now we have a personal protective equipment, a PPE plan, that basically has anybody that has contact with 10 or more patients a day wearing a mask. So if you see our staff in masks, it's just us trying to protect them as much as we can during this pandemic. We have restricted and limited visitation at this time. Restricted visitation at the skilled nursing facility, limited visitation at the hospital. Again, the reasoning for that is that we have many vulnerable elderly or immunocompromised patients in both the skilled nursing facility and the hospital. So we are trying to limit visitation to those areas just to protect those patients that we do have that are seeking care in those locations. We do have some service shutdowns right now, and again, those services have been shut down because they're non-essential services. So to name a few, dental services at Canby Clinic are being offered for 2.5 days a week, and those services are available just for emergent needs. And then we have closed down general surgery at the hospital at this time as well. So those services are no longer available at the hospital. And then our clinics have changed kind of the way that they are seeing patients as well. So any non-essential or routine visits that are with elderly demographic or immunocompromised demographic are being offered either in homes, or they're doing phone visits or telemedicine visits to try to protect those patients that are the most vulnerable for bad outcomes related to COVID-19 at this time. Outside of that, we're asking the public to limit their tasks or their visits to the facility to those that are medically necessary. There are administrative things that could be done over the phone, such as paying your bills, receiving vouchers. We'll even apply those vouchers to your accounts if you call in and tell us that you need your health care district vouchers and you would like them applied to accounts. So just would like to encourage the community to do as much over the phone administratively as they can. We are definitely here, available, open to take care of any medical needs that you do have at this time as well. So please don't hesitate to come in if you do have a medical need, and we're happy to take care of that. I've getting a lot of questions from the community on just whether or not we have enough PPE, masks, gloves, gowns, so on and so forth. We do. At this time, we're in good shape. The entire nation has a shortage of PPE in general, so we are navigating that with everybody else. But at this time, we feel pretty good about our current PPE situation. I get a lot of community members ask me about lab testing supplies as well. We're in good shape with lab testing supplies as well. I think we have over 200 tests available. We are, like I said at the beginning of this video, we are screening patients, and those patients that are tested are patients that have to meet our screening criteria. So we are not actively testing everybody that wants to be tested for COVID-19. We're testing the patients that have symptoms and have traveled and are screening positive on our screening. Outside of those things, just a quick update on what our facility has done so far for testing. We have tested 43 patients. We've received 34 results back. All of those have been negative, and there are currently 9 results that are pending. So there's 9 patients that we haven't received a result back on yet that were taken yesterday or the day before. Just want you guys to know that we really appreciate the community support and the collaboration that we've had with other county and city agencies during this pandemic. We've had a lot of help getting our physical infrastructure set up west of the hospital in case we do have a patient surge or a time where we have many patients show up that need to be screened or cared for that are potential COVID-19 patients. The response from the county and the city health services been tremendous, and we really appreciate the collaboration from those agencies in our community. Also wanted to thank community members. From what we can tell, you guys are doing a fantastic job with social distancing and stay-at-home order. And we really feel like that's had a significant impact on our community and how quickly this may potentially spread, and just appreciate your cooperation. We know that this is a very difficult time for everybody, and we're just very impressed with the response that we've had from the community and community support in other ways too. We've had a number of people order food and things for staff, and we just really appreciate the support that we're feeling from the community. And like I said, we feel prepared. We feel like we're in a pretty good situation. We have a plan if this thing blows up in our community that would allow us to take care of patients and do that in a successful, safe manner. And we're just grateful to be in this community and grateful for all that you're doing to help this situation be as good as it can under the circumstances. And we'll try to produce a video every other week or so to keep the community updated on what we're doing. And just stay tuned, and we'll keep you updated as things change here at Modoc Medical Center.